Hello toppers, today we will be seeing the most interesting and also the most irritating topic, that is MCQ related to COVID-19, and this is part 1. So let us get into the topic. Everyone knows most of the thing regarding COVID, so this can be used as a revision. So first, it was recognized in Wuhan, China in December 2019. And after genetic sequencing, we came to know that it has beta coronavirus, which is closely related to the SARS virus, which had appeared on 2012 in China. Then, regarding the features of coronavirus, it is single-stranded RNA virus, and on electronic microscope appearance, it is crown-like, so it is called as corona. Then, the size is approximately 60 to 140 nanometer with club or petal shaped spikes. I think in virology video we had seen regarding the shape. Then, so COVID is sensitive to ultraviolet rays and it can be inactivated by lipid solvents such as ether 75%, ethanol, chlorine containing disinfectants, peroxyacetic acid, chloroform except for chlorhexidine. So then the most interesting question, that is when COVID-19 is declared as pandemic by WHO, and this date is more and more important. It is 11th March 2020 and still now it is continuing. So everyone knows regarding these variants. So a lot of variants had been identified, and among that the most important variant is UK variant. So some details regarding this. It was first identified on December 14, 2020 and it was called as SARS-CoV-2 VOC 2020-12/01. This is the name given for the UK variant. Let's see some details regarding COVID-19 related to India. So first, the case was reported on 30th January 2020 in Kerala, and we know what step our government had took. It was due to the outbreak of the disease, the countrywide lockdown had been announced, and it is based on the Act, Epidemic Disease Act 1897. Try to remember the year also. Epidemic Disease Act 1897. Then India had launched one app, everyone knows regarding that, it is AAROGYA SETU app, and it was launched on 2nd April 2020, and it is a location based surveillance app. We all know that while using the app we have to switch on the Bluetooth. Based on that data, this will be doing the surveillance. Then this app will be having 11 languages. Mode of transmission, I think everyone have better idea. So direct or indirect or close contact with the infected people through secretions such as saliva and respiratory secretions, even because of droplets. Even if the infected person cough or sneeze or talk, the infection will be spreading. Then airborne transmission, just because of the droplets remaining in the air for longer duration. Then fomite transmission, just because of the surface where the secretions had been expelled out. So then comes period of communicability of COVID-19. So with the help of RT-PCR, we can even identify the disease even 3 days before the onset of the symptoms. And then let's see the duration of RT-PCR positivity. In case of asymptomatic patients, the period is 1 to 2 weeks, and in case of mild to moderate diseases, it will be up to 3 weeks, and in case of severe cases, the RT-PCR positivity will be for longer duration. Incubation period, it is 2 to 14 days. Yes, here another question would be the quarantine period. Quarantine period is nothing but maximum incubation period. So in case of COVID, the quarantine period is 14 days. Clinical presentations. So first fever, then cough, mainly dry cough because it is an atypical pneumonia. Then fatigue will be there. Then anorexia, then shortness of breath, then myalgias. So then we will see the non-specific symptoms of COVID-19. It is sore throat, nasal congestion, headache, diarrhea, nausea and vomiting. Loss of smell and loss of taste precedes even before the symptoms of the disease appears. So let's see the risk factors for COVID-19. First one, it is age more than 60 years. So by increase of age, we can see the increasing risk of developing COVID-19 infection. Then comes the person suffering from non-communicable diseases, mainly uncontrolled, like diabetes, hypertension, cardiac diseases, chronic lung diseases, cerebrovascular diseases, chronic kidney diseases, immunosuppressant stage and cancers. Thank you so much. In next video, we will be continuing part 2. There we can see the laboratory investigations and regarding the vaccinations. Okay, thank you.